Hello, this is Dr. Mowlavi coming from Newport Beach, California. I want to thank everybody for tuning in on my video cast. Today's topic is abdominal etching. I want to remind everybody that they can see all of my video casts at cpsi360.com on the blogs tab in the header of the homepage. Also, I want to remind everybody that you can send your questions to me at askdrmowlavi at cpsi360.com. That's Ask Dr. Mowlavi, DrMowlavi, no period, you guys, at cpsi360.com. So let's get on about today's topic of abdominal etching. I want to remind everybody that abdominal etching was not even possible just a few years ago. So some of the advances in our industry has allowed us to get abdominal etching. What is abdominal etching? Let's start there. Abdominal etching is where you can create now these beautiful abdominal sculptures on humans like we used to on sculptures and clay. And what we're talking about is recreating the muscle definition, muscle highlights, really a higher level of liposuction here. The way we've been able to achieve this is using a technology known as VASER, V-A-S-E-R. That's not laser with an L, but VASER with a V. And what it is describing is ultrasound-assisted energy that allows us now to melt the fat. Okay? We literally tickle the fat from a cluster of fat cells that are semi-solid into single cells that are liquid form. Okay? So that's part one. We're able to melt the fat. Once you melt the fat, then you can literally remove it like a sculptor would. It's not just debulking an area, it's actually sculpting the area and sculpting the muscles of the abdomen, which we'll get into soon. So, before we get into this, I want to explain a little bit of anatomy to you all. What we're talking about is removing the fat, okay? The fat lives between the skin and the muscle. And the fat is actually in two layers. There's a thinner outer layer that's in a compartmentalized area. So what we're talking about is these retaining ligaments. They're these little webs, or a netting system made out of collagen tissue. And it literally separates the fat cells into these little compartments, okay? Now that is in contrast to the deeper fat, which is actually a more generous layer of fat, where the fat is loose and it's just hanging there, okay? So traditionally, we were using large bore cannulas with holes in them to literally drill out the fat. And when you do proper liposuction, you want to uniformly and evenly remove the fat, okay? When we use these traditional cannulas called traditional liposuction, what we had to do was limit ourselves to the deep fat, because the deep fat was loose and didn't have any connective tissue compartmentalization. So we could literally go through there with this cannula and cross-hatch and remove all the fat evenly. That was considered a successful liposuction outcome, when you could uniformly remove the fat, okay? But what that would mean is we could only debulk you, because we could never get that cannula in that superficial layer of fat. Okay, if you tried to put the cannula in that layer, what you would do is you would be able to get it in a little bit, and it would wedge. Once it went in between a couple of these retaining ligaments, compartments, it would get stuck. So there was absolutely no way to uniformly remove the fat from this area. Got it? So if you try to do the superficial fat liposuction with traditional techniques, you would actually get divots and wrinkles and what we call a botched job. Now, with ultrasound-assisted liposuction or VASER technology, we have a probe. This little probe is a lot thinner than the cannula we typically use, and it can go in the superficial and the deep plane. And it actually melts all the fat in both planes. Got it? So we melt the fat. The first half of surgery is melting fat with our VASER probe. Then we go back in with our traditional cannula still, and we can still only go in the deep fat. But what we do is we put that cannula in the deep fat and we siphon off, right? We're not piercing anymore. We're just siphoning the liquid fat out. When we're done with siphoning the deep fat, and by the way, you can get a lot more fat out because you're melting the fat, so it's easier to get out. But when you're done getting the deep fat out completely, then we strategically remove the superficial fat. selectively is what we call it. And you do that by using your non-dominant hand. So my dominant hand is my right hand, where I hold my cannula. But this hand, through a process called compression coupling, is able to now selectively remove the superficial fat. And this is where the magic happens, guys. By being able to selectively remove the fat from the superficial layer, you're actually sculpting now, like an artist would, like a sculptor would. You're now able to get the nuances of the muscles and the definition of the muscles. And what we're talking about is being able to etch out the gullies. That's a Gulley, gully, that is located between each muscle group. So let's talk about some muscle anatomy. Let's talk about the rectus muscle, okay? It's what gives us the 4-pack in ladies and the 6-pack in men. So above the belly button, there's actually 6 muscle bellies in the men and 4 muscle bellies in the women. And these muscle bellies are divided or separated by these gullies. It's those gullies that when they're out show the 4-pack and 6-pack and make you look like a superhero. Well, unless you have body fat that's less than like 5%, the superficial fat does not go away. And you need the superficial fat to be gone to be able to see the gullies. So what we're doing as high definition abdominal etchers, we are now learning how to remove these gullies beautifully in an elegant and natural fashion to allow these muscles to shine through. And this is in essence what we're talking about, you guys. Abdominal etching requires selective removal of superficial fat, and it's honed in on the gullies. Before I get into a little bit more detail about that, I did want to discuss all the muscle bellies that are involved in the abdomen. We typically remove the rectus gullies and define the rectus muscles, but there's also the serratus muscles that are located just below your lateral chest. And these muscles are actually one of the hardest to define, but they're leaf-like, very tiny muscles that live on your ribs. And you're literally defining these muscles by etching out the gullies that exist between ribs. There's also another group of muscles called the external oblique muscles. They're in the mid-waistline area. In women, we core the fat out of this area because we want to maximally narrow your waist and give you that hourglass. In men, often, we keep some of the bulk in this area because we want a stronger, bolder, more prominent external oblique. Not so much a waistline narrowing, but some definition of the external obliques is a beautiful thing. Well, I mean, there you have it, you guys. What we're doing is we're literally bringing out the muscles that exist in your belly by etching out, well, first removing the deeper fat globally, but also etching out that superficial fat. So selectively removing that fat using compression coupling techniques and etching techniques. And literally, we create these beautiful, stunning structures as defined by these 6-packs and 4-packs. And, some of the prominent gullies are the lateral oblique gullies called the semilunaris lines, the midline vertical gully called the linea alba, and the horizontal ones called the inscriptions. There are some nuances between male and females. For example, in the females, we want to concentrate on the vertical gullies, whereas on the men, we want the vertical and the horizontals to give them a more masculinized, a little richer 6-pack, more masculine look. But this is what it's all about. It requires an artistic eye. It requires years of experience. It's almost like being an artisan and learning how to sculpt. And this is what sets apart high-definition providers of body contouring than the rest of us. This is what we're pioneering at our center. And I want to encourage everybody to go to our photo galleries and look at some of these abdominal etchings because they're a work of beauty. They're stunning in appearance. And this was not possible just a few years ago. I hope that you've all enjoyed my abdominal etching video cast today. I encourage you again to send your questions to Ask Dr. Mowlavi at cpsi360.com and also visit our blogs tab on the homepage of cpsi360.com where you can see a lot more of my video casts. Thank you again and hope you have a wonderful day.